Good afternoon, I'm Shane Masters with the Midday News. A special welcome if you're watching on OneSpotMedia.com. As hospitalizations from COVID-19 rise island-wide, Cornwall Regional Hospital in Montego Bay, St. James has now run out of bed spaces on the COVID-19 ward. Director of the Western Regional Health Authority, Errol Green, last night said other hospitals in the region are also filling up.
Cornwall is at 100%. Noel Holmes is at 95%. No complaints out of SAV. I just spoke to the CEO. Not aware of anything unusual, but the numbers are just coming in, so she let me know. And I'm not getting anything out of Falmouth. But if there was a problem at Falmouth, I would have known. So yes, we do have a concern at Cornwall.
However, Mr. Green says Cornwall Regional is not turning away patients.
Nobody's being turned away. Nobody's being turned away. I can tell you, nobody's being turned away. The staff is a bit overwhelmed. We had some staff shortage today. Persons called in sick that were expected to be at work, but we managed to call in other staff, and people doubled up and so on. But I'm not aware of anybody being turned away. No.
The number of patients hospitalized yesterday stood at 245, with 29 listed as critically ill and 68 diagnosed as moderately ill. On February 11, Health Minister Dr. Christopher Tufton said another 133 beds would have been added in coming days. Some of those would come from two field hospitals built at Falmouth in Trelawney and St. Joseph's Hospital in Kingston, and a temporary structure to be repositioned at Spanish Town Hospital in St. Catherine. Meanwhile, Chairman of the Southeast Regional Health Authority, Wentworth Charles, says that region is also having capacity issues. He says while none of the hospitals throughout St. Catherine and Kingston and St. Andrew are full, occupancy levels are very high.
We are not saying that APH does have high numbers also, but between what we are doing is manage our numbers and, for example, remove persons from KPH. We have a ward that we have opened at St. Joseph. And not only that ward, now we have the field hospital at St. Joseph, and we are now staffing the hospital.
Charles was not able to say when the field hospital will be in place at Spanish Town.
I can't tell you the exact date. What is happening now is that we are doing the construction, doing the groundwork to have the hospital put in place. I can't tell you exactly. Contractors have been mobilized, and I know that the work has started.
The Ministry of Health has provided a breakdown of the $978 million it intends to spend on resources to ensure a successful national vaccination program. This is in addition to the $5 billion allocated for procuring COVID-19 vaccines. And we'll return to that story in a short moment. The Yallas High School in St. Thomas has suspended face-to-face classes for a second time in weeks after two teachers and students tested positive for COVID-19. As you'll hear in this report, two other teachers at the institution have been suspected of contracting the virus.
In January, the Yallas High School in St. Thomas had to suspend face-to-face classes because one of its students tested positive for COVID-19. The school was later deep cleaned and sanitized and had to revert to online classes until February 1, when it was deemed safe to resume physical classes. Now a month later, and the institution is again forced to suspend face-to-face classes. This time, 4 persons, 2 teachers and 2 students, tested positive for COVID-19, and at least 2 other teachers are suspected to have contracted the virus. They are awaiting their test results. Principal of the school, Mark Malava, says the decision was made on the weekend following the 4th positive case.
Since I issued a press release, I've gotten confirmation that one other student has tested positive for COVID-19. So that's a total of 4 persons testing positive for COVID-19, including staff personnel. We deemed it best to suspend classes so that we could do contact tracing and sanitize some of those areas that those persons would have come in contact with.
This second suspension has renewed concerns about the disruptions to face-to-face classes as the country grapples with the surge in COVID-19 cases.
The truth of the matter is we have to assess it based on the numbers. The numbers have been climbing steadily up. There has been a lot of debate within the public space as to whether or not we should suspend classes. That's, for me, it is coming to that point where we seriously have to consider whether or not we suspend face-to-face classes, given the numbers.
Classes at the institution are to resume on Thursday. Mr. Malava says the end-of-term exams scheduled for this week will be rescheduled and that deep cleaning will take place during the period. Yallas High is one of several high schools in the parish that had received the green light for face-to-face classes in January, but has been forced to return to online teaching and learning due to the upsurge in COVID-19 cases. Sandy Williams, TVJ News.
Now, back to an earlier story where the Ministry of Health has provided a breakdown of the $978 million it intends to spend on resources to ensure a successful national vaccination program. $286 million will be spent on procuring 3.5 million syringes, and $232 million will go towards hiring 80 temporary staff members across the 4 regional health authorities. A consultant will also develop the vaccination policy at a cost of $2.1 million. A further breakdown of the $978 million budget shows that $150 million has been allocated for a public education program. This includes $22 million to be paid to a consultant firm to develop and implement the communication plan, and $64.3 million for advertising in traditional media and social media. Last week, Prime Minister Andrew Holness indicated that the original budget for the coronavirus vaccine education campaign would be scaled back. $27.8 million is to be spent for 12 public education sessions in each regional health authority. That would include groups, medical professionals, teachers, first responders, and $36.2 million for brochures, flyers, and other material. There will also be an upgrade of the web-based vaccine management system at a cost of $54.3 million. The system will track the movement of vaccines across the island and produce reports on demand and uptake. 4% or $36.2 million of the budget has also been set aside for research. The government's COVID-19 vaccination program will see 2 million Jamaicans being inoculated by March next year. O'Shane Masters, TVJ News. Jamaica recorded close to 300 COVID-19 cases yesterday as the number of hospitalization continues to increase. The Ministry of Health is reporting that 297 new cases were confirmed from 960 samples. This represents a positivity rate of 30.9%. The country's overall case count is 21,679. Their ages range from 1 to 101 years. Kingston and St. Andrew recorded 115 cases, followed by St. James with 62, while 58 were confirmed in St. Catherine. Meanwhile, the country's COVID-19 death toll is almost at 400. 3 more deaths have been confirmed, increasing the death toll to 399. The latest cases are an 89-year-old woman from Kingston and St. Andrew, a 73-year-old woman who lived in St. James, and a 66-year-old Westmoreland woman. Jamaica is yet to get out the blocks in the race against time to start the highly anticipated vaccination process. And according to opposition spokesman on health, Dr. Maurice Guy, the latest COVID-19 case count is still a cause for concern. More in this report.
Jamaica is yet to get vaccines for COVID-19, and as the pressure increases on the government to provide a timeline as to when they will arrive, opposition spokesman on health Dr. Maurice Guy believes the government lapsed in its attempt to secure a vaccine outside the COVAX program.
The government is joining a queue now. We are seeing here where they're hoping to procure at least one vaccination for at least 1 million persons in Jamaica from India. So basically, we had not put our request early in the line, and we are at where we are now.
As at Sunday, 297 new COVID-19 cases were recorded, pushing the country's tally to 21,679. The death toll is also inching closer to the 400 mark, with 3 new COVID-related deaths. 399 Jamaicans have died from the virus so far.
Well, the numbers are certainly worrying. As we had indicated earlier on, even when we had the 403 numbers, we had indicated that the numbers will definitely get higher. We are still seeing a positivity rate in excess of 20%, which basically means that we are not bringing anything under control.
Dr. Guy is urging the Ministry of Health and Wellness to revise the current measures in an effort to deal with the challenges it now faces with the pandemic.
The fact of the matter is that the government needs to reassess how it manages this pandemic now. It needs to do more contact tracing and give results at a faster pace so that the necessary local containment can be done. It is foolhardy, in fact, it's stupid to be having tests done and you wait 4 to 5 days to get the results. You cannot manage a pandemic in that regard. So what we are seeing is not only a consequence of the people not adhering to the protocols, but also government's mismanagement of the pandemic.
Kodian Barrett, TVJ News.
And it's time for a break. Stay with us. More stories when we return. Welcome back. Continuing the news. A fire on Main Street in Orchard Center yesterday caused operations in the town to come to a halt. As we hear in this report from Kodian Barrett, the town only had 1 fire hydrant in the area.
The back of an auto parts shop and a church were damaged by a fire Sunday around 4 p.m. When the fire brigade got to the scene, however, they had to use a hydrant on the other side of town to get water to out the blaze. It's understood that the town only has 1 functioning hydrant. Now, residents are upset that the traffic had to be redirected as the area had to be blocked to facilitate the hose.
We need to do something about it. We can't stand up and just run the town like this. The old town lock off and block off because of the fire. So we're asking whoever in charge, please come and do something serious about Orchard.
While the cause of the fire is not yet known, the owner of the auto parts building is speculating.
Could be cigarette, lighting, and then leave the cigarette butt careless and it's out fire.
According to Mr. Otto, this is the second fire to damage his building, but despite his losses, he says he will bounce back. Meanwhile, Senior Deputy Superintendent Anthony Hines says the lack of hydrants did not hinder firefighters in any way.
It is a fact that we have challenges with our hydrant network, and so we repair hydrants strategically. Notwithstanding, though, that is why when we respond in our predetermined mechanism, a water tender was also a part of the responding mechanism. So, my understanding, there was no issue with water on the scene.
Kodian Barrett, TVJ News.
In news overseas, Boeing has called for the grounding of more than 100 of its 777 jets worldwide, this following an engine failure of the United Airlines plane on Saturday. More from the CNN.
The awfulness of seeing their engine blow up once, and they've seen the report that says there needs to be greater inspections. And when you look at the history of that incident and this incident, you see it's virtually identical. The engine looks the same. Look, Julia, these engines are designed to contain any explosion. That's the brown Kevlar that you see there at the front of the engine. What has happened here is with such force, those blades are spinning at 3,000 revolutions a minute at least when the plane's in the cruise. And if you think about the force, one of those blades could move a car over a several-story building in terms of the force that it expels. And when it was liberated, as to use the language, from the engine, that's what you saw. The 2 things that are a miracle, well, 3 things. Firstly, that it didn't remove the wing in the process. Secondly, it didn't rupture the fuselage or anything, any of the fuel lines. And thirdly, and perhaps most crucially, once you lose something from a plane, it's going to fall to the ground, that nobody was killed on the ground or injured.
In sports, national sprinter Julian Ford says he is hopeful of a strong showing in 2021, including competing at the Tokyo Olympics despite the continued restrictions brought on by the COVID-19 pandemic, both locally and internationally. He is also calling for due importance to be placed on boys and girls champs despite the pandemic. Jeremy Brown reports.
MVP sprinter Julian Ford is among a number of local-based senior athletes who are still waiting to get their 2021 seasons on the way, especially with an eye on competing at the Tokyo Olympics this summer. The 28-year-old has had to get used to the new norm of training with COVID-19 protocols in place, while not being able to compete as yet because of the continued restrictions in place by the Jamaican government. But he says he has been able to deal with the uncertainty much better than last year.
It's more normal than last year. Last year it was extremely new to everybody and nobody really knew how to handle it. But with, following the protocol and all the, recommendations that have been made to us, on how to train, I think we're managing fairly well.
Ford has also welcomed the recent announcement by the government of a lifting of restrictions on some sporting disciplines on a case-by-case basis. The former Wolmer's Boys Champs winner says he is particularly hopeful that the nation's juniors will get to compete, especially with Champs being the nursery for Jamaican track and field.
It's a necessity for the athletes. Not just even the senior athletes, but I feel for the athletes that are looking forward to compete at the Boys and Girls Championships. Being a high school athlete, I know what it's like to look forward to the champs. So I'm really happy that the government are doing things to make sure that athletes can get competition and that they can compete at champs.
And as for his own season, the Steve Francis coached athlete who is aiming to make his second Olympic team explains why he remains confident of a busy season.
I try not to think about that. I just continue to put in the work in the event that we will get to compete. So I'm looking forward to every single competition that we get to do. But I can say for sure, knowing my coach, we will definitely get a chance to compete. Even if it's just among ourselves, we'll do it in a competition style environment. And so I'm just doing all that I need to do to prepare and make sure that I'm in the best shape when it comes to the games.
Ford, a 2016 Olympian, owns personal bests of 9.91 seconds and 19.97 for the 100 and 200 meters respectively. Jermaine Brown reporting for TVJ Sports.
And that's the midday news. I'm Shane Masters. Join us at 7 for primetime news. On behalf of the news, sports and production teams, good afternoon.